Hey future nurses, welcome to our NCLEX review classes. Today we are unraveling the mysteries of shock. Shock is a medical emergency that's more than just a fainting spell. It's a dire situation where organs are starved of blood. Think of it as traffic jam in your body's highway. There are several types of shock, each with unique features. Today we will explore hypovolemic, cardiogenic, distributive, which includes septic, neurogenic, and anaphylactic, and obstructive shock. First up, hypovolemic shock. It occurs with significant blood or fluid loss. Think of a car accident victim. Key signs: low blood pressure, a fast but weak pulse, cold and clammy skin, rapid breathing, and dizziness. It's a race against time, and we compare this with rapid fluid replacement, bleeding control, and oxygen therapy. Constant monitoring is crucial. Now on to cardiogenic shock, which often following a heart attack. The heart struggles to pump. Imagine a damaged water pump in a garden. Symptoms include chest pain, irregular heartbeat, shortness of breath, fatigue or weakness, cold and sweaty skin. Treatment: medications like vasopressor, mechanical support, and ensuring the patient gets enough rest and oxygen. Distributive shock occurs when there is a problem with the distribution of blood flow in the body circulatory system. It's like having a perfect amount of water in the garden, but the watering system fails to distribute it evenly to all plants. Now, why distributive shock is so unique? Unlike hypovolemic shock, where there is a physical loss of blood volume, or in cardiogenic shock, where the heart fails to pump effectively, distributive shock occurs even though there is adequate blood volume. The problem in distributive shock lies in the distribution of this blood within the vascular system. In distributive shock, there is widespread dilation of the blood vessels. This dilation leads to a significant decrease in systemic vascular resistance, causing blood to pool in the peripheral vessels. As a result, less blood returns to the heart and less oxygen-rich blood reaches vital organs. Distributive shock is further divided in three types: septic, neurogenic, and anaphylactic shock. In septic shock, a severe infection causes an overwhelming immune response. Symptoms include fever or hypothermia, rapid heart rate, confusion or disorientation, low blood pressure despite fluid resuscitation, and decreased urine output. Treatment involves antibiotics, fluid resuscitation, and sometimes vasopressors. Neurogenic shock happens with spinal cord injuries, disrupting blood flow regulation. Imagine losing control over your body's traffic lights. Symptoms include low blood pressure, slow heart rate, weakness or paralysis below the injury level, and difficulty breathing. Treatment involves stabilizing the spine, and careful fluid management are essential. Anaphylactic shock is a severe allergic reaction causing widespread vessel dilation. It's like the body's defense system overreacting to harmless substances. Symptoms include difficulty breathing, swelling of the lips, throat, and face, and a rapid drop in blood pressure, itching, nausea, or vomiting. Interventions: here epinephrine is lifesaver along with antihistamines and steroids, IV fluids, and airway management. The swelling of the throat can quickly lead to obstruction of the airway, making it difficult or impossible for the patient to breathe. So keeping the airway open is essential to ensure that the patient can continue to breathe effectively. Lastly, obstructive shock. Think of a pulmonary embolism as a blockage in a major tunnel. Symptoms include difficulty breathing, chest pain or discomfort, rapid heart rate, coughing up blood, and fainting or lightheadedness. The key interventions: focuses on removing the obstruction, provide oxygen, and sometimes use vasopressors. Remember folks, shock is a complex condition. Quick recognition and tailored treatment are critical. Every step of shock has its nuances, and as healthcare providers, our role in swift and effective management can save lives. Keep learning, keep saving lives. Thanks for being part of our discussion on shock today. If you are interested in more such content, don't forget to follow us for the latest updates and NCLEX preparation tips. Your journey in nursing education is important to us. Stay curious, stay informed, and see you in our next session.